Hi, I'm Dr. Noel Lucas from Blue Oasis Pet Hospital, and I'm going to answer some questions that you may have about your dog's lab work and why we might recommend it as veterinarians. And I have an assistant who's going to ask me some questions that you might have about canine lab work.
Dr. Lucas, why my dog might need lab work? Why would I need lab work?
Yeah. So lab work is a big catch-all. Usually when we're talking about lab work, we're talking about blood and urine samples that we're going to collect from your dog to send off or analyze for different types of, we're just looking at how the internal organs functioning in your dog by doing some lab work. So lab work is a big catch-all for blood and urine tests typically.
What are the different types that we're going to go right into what you were just talking about?
Yeah, so different types of lab work. It just depends on the life stage of your dog, quite honestly, or what we're about ready to do for your dog that day. If you're coming in for an annual comprehensive wellness checkup, a lot of times if your dog's a younger dog, we're going to recommend at least heartworm and tick-borne disease screening. We call that a 4DX test because that's what it is. It's looking for different types of tick-borne diseases or vector-borne diseases. So blood tests related to vector-borne diseases, heartworm and tick-borne disease. We're going to look for fecal examinations. We didn't talk about a diagnostic test would be a fecal exam. That's going to look for intestinal parasites. But we're also going to probably want to look at just like we call it a CBC, a complete blood count. That's going to look at red blood cells, white blood cells, and platelets in your dog. And then at least a small metabolic panel. That's just going to look at our core organ function like liver and kidney and electrolytes. We're just checking kind of the internal organ systems and making sure that those look healthy too. Those are the most common tests that are done in young dog. In an older dog, we're just going to usually do all the same testing, but we're going to start maybe adding in some hormonal testing, and we're going to expand our metabolic panel out because we're looking for more diseases that can be acquired as they get older.
Why are routine blood tests so really important?
Yeah, so why is a routine blood test so important is because we as veterinarians are really good with our diagnostic tools, which are hands, eyes, ears, and nose to really do good physical exams on your dog, but we can't really see inside your dog in terms of like what health conditions might be happening with organ function or diseases. So that's where lab work kind of fits in with the physical exam so that we're getting a more robust or overall picture of your dog's health.
What do the chemistries mean on my dog's blood work? There's a lot of panels in there.
Yeah, so the chemistry, the actual individual chemistries that we run are very similar to what our doctors run for us. And they are the same metabolic processes that are happening with your dog that are happening with us. So we're going to check like blood sugar, we're going to check BUN and creatinine, which are very specific for kidneys. We're going to look at electrolytes like sodium and potassium and chloride. We're going to be looking at liver values, which are ALT, and there's a gallbladder enzyme as well called a GGT. So there's a lot of words that you're probably not familiar with that we are, but we actually can send you documents that explain what each individual test is. Obviously you can look on the internet for these different terms, but your doctor, if we find some abnormalities, is often going to explain what they are to you, and then we're going to want to probably follow those values over time if they're abnormal.
Does a baseline lab test benefit the health of my dog every year?
So how does a baseline blood work affect their health? So if we're looking at their blood and we find that they have a very normal health panel, that gives us a good baseline while they're nice and healthy. So that maybe next year they come in, maybe they look healthy, but we take some more blood and we compare it to that own personal dog's blood work that they had maybe a year ago. Maybe we're seeing that something's trending a little bit off. That's not what they normally are. So we can actually get a really good barometer of your own dog's health based on serial blood work or blood work we're doing every year and trending it to your own dog's natural health. So we're able to detect disease a lot faster when we do that and intervene a lot sooner. So early detection is key with serial blood work or blood work every year. And when we find something early, we can maybe intervene, we can change the course of the disease, and we can follow up and make sure that what we've done has helped your dog. That gives them the best chance to live a healthy life by finding disease early, and blood work is a key to being able to partner with you to be able to do that. So we encourage that all dog owners get their dog examined once a year and then follow their doctor's recommendations on what blood work or diagnostic tests that may be recommended. And we'd love to see you at Blue Oasis if you need a dog partnership with your veterinarian. Thanks so much.